Hi everyone, it's Dr. Lisa Miller. I'm a clinical pharmacist and a Menopause Society certified menopause practitioner. And I wanted to talk to you a little bit about testosterone. It's a question that I get a lot, and there's not a whole lot of information about it. So hopefully this will answer some of your questions. And if you still have questions after this little video, then please feel free to reach out to me at any time. So testosterone for women. So it does help with several things. It helps with the pelvic floor. It helps with the bladder, the urethra, and the vagina. So everything in that area, it's very helpful for. Now, there are some studies that have shown that women who take it experience more sexual interest, initiate sex more often, and have better orgasms. So right now, most of the major societies, North American Menopause Society, the Endocrine Society, most of them um, recognize its benefit for one specific type of sexual dysfunction called hypoactive sexual dysfunction. But in clinical practice, women will tell you that it's effective for all types, for a lot of women, a lot of different types of issues that we just mentioned here a second ago. Now, I want to help you understand how testosterone is used, whether or not you need to get levels, how you obtain the product, all of those things. So first, I want you to understand that testosterone is either in your body as a free form or it's going to be bound to something called sex hormone-binding globulin. And only the free form of testosterone is actually able to act in your body. So if it's bound up to this binding globulin called SHBG, then it's kind of not helpful to you. And so only the free testosterone is active. I'm going to talk a little bit more about that in just a second. The other really important thing to know is that it's actually not FDA approved for women. So this means that your insurance company most likely will not pay for it if you're a woman using it for perimenopause or menopause symptoms. The only way that you can obtain testosterone then is you can use the male prescription product. This would require a physician to write the prescription for you. And again, it would not be an FDA approved use, it would be considered an off label use. And then the dose to start with is typically 1/10 of the male prescription dose. So oftentimes, if you use the prescription product, you'll have a little tiny tube of testosterone gel, and it comes in both a tube and a packet. And I always recommend physicians to write for the tube of gel as opposed to the packet because the most men are using the whole tube or the whole packet, but women are only using 1/10 of that, and it tends to evaporate if you can't close it up tightly, and so that's why the tube is always preferred. So it's a tiny tube of gel, and it's only 1/10 of that. So typically, a dose would be to put 5 pea-sized drops on your hand, and then rub that usually on your outer thigh. And I tell women, don't rub that in, don't keep rubbing it because it's made with an alcohol base and it's meant to sort of evaporate. And as it evaporates, the testosterone is absorbed. And so I always tell women it's best to do it right after you get out of the shower. You can put it on and then continue getting ready however you normally do, because it's going to take about 5 or 10 minutes before it completely dries. And sometimes it feels a little sticky before then, so you don't want to put clothes on it. It can be hard for women to measure that little tiny bit out. But that one tube, if you use 5 little pea-sized drops, should last you 10 days. So 10 doses out of that one small tube. So you can see why that can be a bit of a challenge. Then based upon your symptoms, sometimes your doctor might increase you to 7 little pea-sized amounts. And then in that case, your tube would only last you 7 days. But that's kind of how it works. Now, this is the one time that I think that compounding pharmacies can really be helpful here, because there are a lot of compounding pharmacies that will take that 1/10 of a dose and put it in a cream or lotion base that's easier for you to measure out. It's a lot of times in a little clip device. And so it makes it easier and more accurate for you to measure your own testosterone dose. So how soon can you see improvement? Well, you can see improvement in as early as 6 to 8 weeks. And that's typically if you're using it for sexual desire issues. It can take up to 3 months, though, to see the full effect. And honestly, many, many women that I've talked to see results much sooner than the 6 to 8 weeks, depending upon what they're using it for. And usually you're going to treat for about 6 to 12 months, and then you attempt what they call a drug holiday. And all that means is that you come off it for a while, and that gives you the chance to see, do I really still need to take it? Now, monitoring your symptoms, the symptoms that caused you to take the testosterone in the first place, is really important because your symptom improvement doesn't always correlate with the levels. So here we are to talk about levels of testosterone. Do we need to check them? Why do we check them? So it's not really necessary to check your testosterone levels to start therapy. You typically go by your symptoms that you're having. Some physicians like to order a testosterone level just to get an idea, just to make sure that you're not already out of range. But a lot of physicians don't order the testosterone level. It's not absolutely necessary. But you do want to monitor testosterone levels during therapy. Again, you're not doing that to see if you're at the right level for symptom improvement, because again, it's going to vary from person to person. You're only checking the testosterone levels to make sure that you're not outside or too high, outside that therapeutic range. So what you do is 3 to 6 weeks after you've started your testosterone, the physician will order your labs. And then anytime you have a change of dose, they'll typically check your labs again within about 6 weeks. Now, anytime your level is outside of the normal therapeutic range, they do recommend that you kind of back off on your dose. And that's even if you don't have toxic symptoms. And toxic symptoms can be female pattern hair loss, hair growth on the face, some cardiovascular, some lipid issues, some cholesterol issues. So you don't want to be in that toxic range, basically. So if you're in that range, you want to go a little bit lower and then see how you're doing. And it's also not a bad idea to ask for the sex hormone binding globulin level that we talked about at the very beginning, because what you can do with that, especially if you are, in a good range and you're still not having symptom relief, or if your levels are high. So say, for example, they are a little bit elevated, but you're still not having symptom relief, you could have high levels of this SHBG. And remember, if you have SHBG, it grabs a hold of testosterone and binds it up. So you may not have enough free testosterone there. And so your total level is looking at both the free and the bound. And so you may look like you have too much testosterone, but really the amount of free available to you is too low. So it's often a good idea just to check those binding globulin levels in addition to the total testosterone. And then you can do a calculator. There's plenty of those online, and it'll allow you to calculate that free amount. And then once you're stable, typically you just check every 4 to 6 months just to kind of see where you're at and make sure you're not too toxic. You also, again, want to monitor the side effects that you can have that would show your level might be too high. And then also look for symptom improvement. And then again, after about 6 to 12 months, you might want to go off it for a bit and see how you do. And then the last thing I'd like to mention is the topic of the subcutaneous implants. Now, I know this is a little bit controversial. I know there's plenty of women and physicians who use these regularly and like them and don't have problems with them. But I've also seen plenty of women who end up with too much or too high of a dose. So if you're just doing the little pea-size amounts each day and you have your blood drawn and you have too much testosterone, it's pretty easy to get it back down by stopping the gel. But when you have it implanted in your arm, all you can do is take the implant out, and it's still in your system even after the implant's removed for quite a long time. And so I've seen women, suffer from side effects for a long time before their levels come down. So I think it's just a little bit tricky to dose it, and it is a lot more useful for the woman to not have to use the medication every day. So it's a lot easier to use, but it does come with some potential problems. So I hope this has been helpful. If there are any other questions that you have, please let me know. Again, I am not a physician, so I don't diagnose or treat. And this information is just for your use to discuss these matters with your physician. So if you would like to contact me, you can email me at lisa@loveyourmidlife.org. You can also join my email list where I email a couple times a week or a month some of the latest news in menopause. And then I also have a program called I Can't Sleep, which helps perimenopausal and menopausal women who are struggling with sleep but don't want to use addicting sleep medications and want to do things more naturally. Have a great day and love your midlife.